Well, good afternoon, everybody. It is my absolute privilege today to be sitting here with Professor Mahmood Bhutta. He is a surgeon, a scientist, and global advocate whose work spans the clinic, the classroom, and communities around the world. Professor Bhutta is a chair in ENT surgery at Brighton and Sussex Medical School and a consultant ENT surgeon with a subspecialty in otology. His clinical and research work on chronic ear disease has been internationally recognized with over 150 publications, 2 books, and more than 4,000 citations. His research has brought new insights into the genetics and pathophysiology of chronic otitis media and has shaped global understanding of ear disease. His academic journey includes a medical degree from King's College School of Medicine, where he graduated with honors with a distinction in pathology, and a doctorate in philosophy from the University of Oxford. He has subsequently had prestigious fellowships in the UK and Australia and worked in low-resource settings training surgeons and healthcare workers across Africa and Asia. He has also served as a consultant to the World Health Organization on ear and hearing care and has led global education efforts in this space. But what truly sets Professor Bhutta apart is his leadership in sustainable healthcare. From exposing labor abuses in medical supply chains to helping shape NHS and global procurement policies, he has become a leading voice on environmental and ethical reform in healthcare. His work has been featured in The Lancet, British Medical Journal, and the WHO Bulletin, and in 2024, he was awarded the President's Medal from the Royal College of Physicians and Surgeons of Glasgow for his contributions to global health and sustainability. And in the same year, he was also awarded the Nikhil J. Bhatt International Humanitarian Award by the American Academy of Otolaryngology. Thank you for joining us today, Professor Bhutta. It's so nice to have you here.
Thank you. It's a pleasure.
Hello, this is Laurie Lalakea, formerly of ENT here at Valley Medical Center, and Climate Action Position Champion here at SCVH. We're so delighted to have you, and we're hoping we can pick your brain a little bit and in the sustainability space in particular. So we're wondering, first off, what sparked your interest in sustainability in the healthcare space, and how did that grow out of your clinical and academic work?
So thank you. I suppose for me, it started really when I was a child, really, as a teenager. I was always reading about things, and I read about this thing called climate change. So this was perhaps 30 years ago, maybe even longer than that. People think that climate change is new, but it was modeled and it was known about for a long, long time. So I got interested in that idea then that, there were things bigger than all of us that could have serious consequences for all of us. I also read books such as No Logo by Naomi Klein, which talked about abuse of workers in various industries, and it became clear to me that the world was perhaps heading the wrong way. In terms of bringing it into healthcare, it was perhaps luck. My parents are actually from the north of Pakistan, and I was traveling through the north of Pakistan with one of my cousins, knowing that I was wanting to be a surgeon. This was many years ago, 20 years ago, asked me if I wanted to see how surgical instruments are made. And what I saw shocked me. It was, in essence, workers making these medical instruments going all over the world, including to the US, surgical instruments in sweatshop labor conditions, including children as young as 7 working on grinding machines to make these things. So at that time, I raised concerns and I said, look, I've just come across this. What else is going on in terms of our throwaway economy, in terms of the destruction of our planet? If I'm honest, it wasn't a huge topic back then, and I'm glad that now at least we're talking about this. And yeah, I guess, again, it was fortuitous. Someone came to me interested in doing some research, and I suggested the idea of trying to look at the environmental harms from supply chains. That individual did her PhD, we gathered some data, and then the world changed and understood that sustainability was something important, and I'm glad to be here.
And that is Dr. Rizan, is that? Yes.
Indeed, Chantal Rizan, who did her PhD under me, yeah.
You've led major efforts to improve sustainability in the OR and across healthcare supply chains. What are a few successes you are most proud of? And what challenges have you noted that have been pretty hard to move the needle on?
Sure. one of the difficulties is knowing if you're having any real effect. So, indeed, I've been fortunate that I was asked to chair a national, effectively international report into how to make surgery greener, because surgery, I'm a surgeon, is terrible for our planet. We produced a report. What was really good was to see that lots of people were supportive of the idea. It was a mainstream idea. Senior people were indeed supportive. So that's great. I hear stories all the time of people saying, actually, I have changed what I do. And those things make you think that you're having real effect. So that drives you. But the reality is that we are dealing with very complex, difficult systems. And so just saying that, hey, we should move, for example, my particular interest is how we stop throwing so many things away. Mm-hmm. The reality is I can't just say, oh, let's stop throwing things away. Well, the barriers are, hang on, this is the way we do things. You want to change the whole system. There are regulations around how we can use things. There are infection control policies. There are apparent financial drivers, which are often fake. There is a lack of infrastructure. So for individuals to create change, I think, has always been a real challenge. I don't take that as too negative, because actually, if we get the like-minded individuals together, as you've shown here, indeed, in this hospital, you can create change. You can start to send that idea. What also enthuses me is that the message is now getting widespread. I think people, certainly in the UK, are talking a lot about reuse, and that's the good thing, that at least we're talking about it now. And the government is also strongly supportive of this idea. So in the UK, our government has committed to minimising single-use medical products by 2040.
That's awesome. It's wonderful.
You talked a little bit about barriers already, the systemic barriers, but maybe you could expand a little bit more on how we can try to overcome them. There's certainly a strong incentive on the part of producers to be selling us single-use devices. Here in the U.S., in order for a company to make a product that is multiple use, it takes way more steps, way more boxes to check. And so currently companies are not incentivized to make that multi-use product. What are some of the ways that you can tell us to combat some of those systemic issues?
Sure. Again, these are big issues, and of course, I suppose the problem is that it's multifaceted, so we can't just tackle one aspect of it. So I've already mentioned, in terms of the infection risk, and related to that, as you've implied, the instructions for use for a product have to be changed, and there's a whole regulatory cycle around that. So I suppose there's a few things I would say. It is the infrastructure to enable reuse. If we don't have that, then it's very difficult to reuse. If we don't have the regulatory environment and we don't have the economic arguments, then that also makes it difficult. So in essence, we need to change, I think, all of the incentives to make that journey easier. That includes perhaps institutions, and this is something we're trialling in the UK, where a number of organisations, what's called the Circular Economy Healthcare Alliance, has been launched. We have 7 or 8 large hospital providers who are saying we will always buy a reusable product wherever it is clinically safe and feasible to do so. And there are a number of reusable products out there. So that sends a clear signal to market that that's what we want. That may make it worthwhile, their investment in creating that product and certifying it as reusable. We also are trying to meet with the regulators to say, hang on, let's be sensible about your regulations. Because I know in the UK, the regulations are, even if you want to change the packaging of your product, you have to go through the entire regulatory cycle, which seems bizarre. So let's make reuse easier in terms of regulation, in terms of the financial incentives. There are other economic models we can use. We can use servitization economics, where we buy a service rather than a product. So, for example, if you've got an electrosurgical dissector, you say, I want to buy an electrosurgical dissection service for 5 years, or even a full electrical, everything I need in the OR is on a service contract. For 5 years, this company will get that contract. It gives them security of the finance, but it changes the model, where if they are going to throw away everything that they produce, it's going to cost them, not us. We know that when that happens, that changes their behavior. They make products that are designed to be reuse, and they take them back at the end of the cycle because we say we didn't buy the product, that is your
Yes.
product. We also need infection control to come on board. We need, either local or preferably national policy that says this is okay. We take away that risk because people are scared of doing things that seem to go against regulations. So that's another aspect. And then finally, we need to build the infrastructure to enable things to be reused. We need to look at the models of, whether we want reusable textiles, reusable instruments. We need to invest in that infrastructure. What we do know is from multiple examples that actually this seems to save money in almost all cases. So that in itself should be a big driver, because I imagine, as we have in the UK, a real incentive to save money in health.
Mm-hmm.
You touched upon that there are about 7 different hospitals that are trying to go more green, for lack of a better word. Are there any incentives that the UK is giving those hospital systems for those more green purchases or sustainable purchases?
In essence,
that you know of?
Yeah. In essence, no. And that's been a stumbling barrier.
Mm-hmm.
But what we are recording is all the financial savings. So in my hospital, we've just done about 5 things. What we've done is we have moved our instruments in the ENT department to all be reusable. They were bizarrely disposable when I arrived. That changed. In ophthalmology, they've done the same. In our accident emergency, we are not throwing away instruments. They're all reusable. Our tourniquets are now wiped down and reused. And our nasendoscopes undergo ultraviolet light decontamination rather than through washers. That altogether is saving us about $500,000 a year. So that's what really.
So that's the
drives
incentive
it.
right there.
That's the incentive. Sometimes you have to invest to save, and
Yeah.
that's the difficulty. Trying to get some money out to say, hey, you need to put into this new process. But we're demonstrating real world change, and that's what drives people. And across the alliance, what we're trying to, this Alliance Circular Economy Healthcare Alliance, we're trying to demonstrate and model the carbon savings. I'm not suggesting we carbon footprint everything. That puts people off. It's complicated, difficult. I
Yeah.
suggest we do, but actually put some metrics on it. But more importantly, put the metrics of the financial savings. So that's what drives it.
Just following on to that, in terms of incentivization, what about frontline workers and getting the word out? So maybe leadership here and there, maybe physician here and there is interested in pushing sustainability. But what about every frontline worker? What is the way to inspire, advocate, educate, incentivize so that solutions are bought into and become more scalable?
Sure. I mean, I say that those who are interested can all play a role in this. So the classic example, as I'm sure you're aware, is the use of gloves. People are wearing gloves for often without good reason. It's become habitual. And so those of us who wear gloves can model the change. What we do know is from multiple pieces of evidence that I've gathered is that the change usually comes from modeling what people around you are doing. So be the leader to say, hey, I'm only wearing gloves when it's appropriate to do so. So when I'm in contact with basically sticky, wet substances that might have lots of bacteria on them, open wounds, etc., the rest of the time, I'm going to wash my hands. That sort of local model behavior modeling is important. You can be the leader there. You can do more than that, of course, as well, if you feel able. You can try to create a little group of people. What I've found is people often say, well, once you start talking about it, actually lots of people do think it's important and they want to come together and work on it. It's just they haven't been given that voice and that authority to do that. And if you want to go even further, if you are, let's be honest, if you're a surgeon, you can have a strong voice. Well, why not use your voice for something good and say, actually, no, I want this to be a reusable product. I want to support this. The first thing I did when I joined my hospital was I went and spoke to the chief executive and made sure that this was part of our strategy so that everybody feels enabled. So I think people can do small things, but let's not belittle those small things. They're important, and people can do big things as they feel able.
Just one comment there about incentive, and the financial argument can be a powerful one for leadership level. But I think for frontline workers who are paid on salary, saving 5 cents on a glove that's not used, that's not a very powerful motivation. So adding in the environmental motivation, I think, can be very powerful, and understanding who is your audience. Is it an audience that's going to respond to dollars, or an audience that's going to respond to another incentive?
Yeah, sure. No, I think you're right. So I think there's two aspects. No, people don't like to think I'm trying to scrimp and save to put either myself at risk or my patients at risk.
Yeah.
And nobody should be doing that.
Yeah.
Nobody likes to think that doing green things is also about compromising patient safety. I've never said that. It's just about good systems. So you're right. The environmental harms, I guess different people are motivated in different ways. I mean, I realize I'm speaking to the converted, and I'm also coming from that sort of setting. But yes, every single glove you put on, of course, causes harm to our planet. It's just may seem distant, but we know that 70% of the world's gloves are manufactured in Malaysia. Most of the rest are manufactured in China. They're all manufactured from plastics. They're all brought over. Think of the environmental harm that causes. We also know that the vast majority of them are linked to forced labor. So almost all the gloves manufactured in Malaysia are made under forced labor condition, using migrant workers who have paid illegal recruitment fees to come and work in these factories. So for me, every time I put on a glove, it's not just about finance, which, to be honest, I don't think about. It's about the environmental harm, and it's about thinking what I'm putting on my hands is actually made using forced labor. I don't want to do that unless I need to. In addition, it's about good patient care, because when people put on gloves, they don't wash their hands,
Right.
and people have this idea that these gloves are magic. They don't spread infection. They spread infection just as well as anything else. And we know that half of the gloves, for example, that come out of a box are infected when they come out. So you are not preventing infection. Who was the last person who put their hand in that box? So this is all about good care.
Absolutely. I concur with that. I think for myself, I think about that glove getting into a truck and going to our local landfill. That local aspect. These landfills are in the neighborhoods of underrepresented minorities and low-income families. And for us in a safety net hospital, that is very much the population that we serve. And so there's that piece of the ethical argument of we are, in the grander scheme of things, harming the health of our very population that we are most interested in keeping safe. Yeah.
So working in this space of sustainability can be overwhelming at times. And so just a couple takeaways. So what keeps you motivated? What keeps you going and continuing and excelling and finding new projects to work on to be in this space? And then what are some key messages you hope listeners will walk away with after hearing your story?
Thank you. So let's be honest, it's not always easy. And it's not always easy for me either. You sometimes think, wow, these forces are so large. Are we actually going to change anything? Am I putting a huge amount of effort into something that's not going to do anything? But what motivates you is, or what motivates me, is actually, it seems this is something worth fighting for. This is something bigger than all of us. It's about these injustices, both to local populations, but also populations around the world. And sometimes I think, I'm having no effect. But then I sometimes think, well, if I didn't do anything, it would be even worse. So I'm also, what keeps me motivated is seeing that people, even today, giving the talk has been really encouraging to see that people actually do feel and do care about these sorts of things and want to create change. So I think actually, particularly in healthcare, most of us, I think, are gone into healthcare for good reasons. We can see that there is something beyond us, and so those people are the right audience to try and take this forward. The take-home message, I guess, is always, look, it can feel overwhelming, but don't underestimate how each of us can create even little changes or big changes. We sometimes think that the system is the thing that's going to create this change or is responsible, but all change in history has always come from individuals or groups of individuals starting and working together. So it may feel overwhelming, but we all can do more than we think.
Oh, that's wonderful. It's a great take-home message. Thank you so much. Any other questions, Dr. Lalakea?
No, I don't think so. Wonderful messages, and I like that idea of every little bit helps. Every little bit is a drop in the pond that can create ripples. I also personally think when I'm talking to frontline workers that, yes, it'd be great if the system up there would just fix things, but the larger system doesn't really understand how we deliver care. As surgeons, that instrument is in my hand. I asked for it. I ordered that MRI. I understand how we are taking care of this wound in a way that the C-suite does not. And so I think it's equally important that people who are delivering the care are involved just as much as people who are up at the top controlling purse strings and direction.
I agree.
Yeah.
Thank you so much for your time with giving us a lecture today and even sitting down with us with this podcast today. I think we have taken away so many points from you. And I was even saying earlier, I've already received so many messages of people who are so inspired by everything that you've said today and all of your work that you're doing and want to get involved and are trying to find out anything that they can do to be part of this change, because I think we all realize that it's necessary and it's never going to just be one person. But we appreciate your voice because it is loud, and we really, really need people to be loud. So thank you so much. We really appreciate you coming today.
And huge shout out to Dr. Vidya Mony for arranging all of this.
I don't even think I introduced myself in the beginning either. I'm Vidya Mony. I'm pediatric infectious disease and one of the hospital epidemiologists here. So thank you so much, you guys. This has been phenomenal. You're so inspiring, Professor Bhutta. I mean, gosh, just like we could just ask you questions all day long here. So thank you so much.
Thank you for having me, and thank you for your kind words.
Thank you.